Hello everyone, this is Shalu Kumar from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. Welcome back to my another video for your adult NMC OSCE exam. I hope you like my videos. So if you like my videos, please press the like button now and subscribe to my channel. It just gives me a lot of positivity to keep making these videos for you. And looking at your comments, it looks like you are liking the videos and they are really helping you to pass your exam, hopefully first time. Okay, so in today's video, another video today, again, I'm going to do another one like last week on the common fails again. Okay, so in last few months, what have been the common fails in your implementation station? Okay, it's your drug administration station. So really important station in your exam, commonly failed station as well. It's one of the most commonly failed station alongside assessment. So in your API, so we're going to look at what have been the 5 common fails, and then I'm going to give you my tip to go with how you can avoid those fails. Okay, so we're going to talk about 5 common fails, and also I'm going to let you know how to not fall in that trap and not make those mistakes. Okay, so straight in, right, let's do the first one. So the first one is failure to read validity of the prescribed medication. So okay, so that's your when you start reading your drug chart, read it systematically from page 2 to the end, last page. Okay, and you need to check the validity of every prescription, even if they're not due at your time. You need to know the drug history, whole drug history of the patient. So you need to check the validity of every prescription and make sure you read it very systematically. If you don't read the validity completely and you give those medications, it's a absolute fail. Okay, it's a critical fail because it's not safe to give medication unless you have checked that the prescription is valid and legible. Okay, so it should have all the things you need to have for validity. So that's the reason of the most common fail at the moment. We are saying this is the top first reason, failure to read the validity or check the validity of the prescription. So my top tip will be, what happens is in your exam, if you look at the screen, I shown you like obviously one of the regular medication you're reading, and then you are reading the medication, but then you get tempted to look at the times. Is it due at my time? You know you're under time restriction, and it's automatically, it's human nature to look at the time and decide to give or not give. Okay, so you want to make that decision quickly, but then if you make the decision to give, getting tempted to look at the time, you're not checking the validity. So my tip will be, avoid looking at the times. Okay, check the validity of the prescription, then check if it's due at your time or not, because you have to read the validity of every prescription and every drug on the drug chart, whether it's due at your time or not. Or you can put your right hand, as you're reading the drug chart, put the right hand on the time high day, so you're not even tempted to look at the time. So you check the validity first, because that has been the most common fail of this station. So you make sure you checking the drug name, the date, the dose, you're reading the frequency, you're reading the route, you're reading the duration, start date, finish date, prescriber signature, bleep number, and name. So that's really important that you check all that before. So that is part of the validity. Now pharmacy check is not part of the validity. You can just say pharmacy check is there or not, but rest of it is definitely part of the validity. Now certain drugs you don't need to have start date and date, because they are your regular, drugs which patient use long term, or they are your as required drugs. Okay, so that's different, but what I'm trying to say is that you definitely need to read the validity first, then look at the time. So don't fall in that trap. Tip number 2 will be administer medication. That has been the common fail, that a nurse administered the medication that patient is allergic to. Okay, so that is obviously completely will be a critical fail if a person end up giving allergic drug to a patient, okay, a nurse. So that's really important. Now you know the allergies are on page 2 of the document. You read it in the beginning, but then you kind of you know it, but you don't connect it to your drugs when you read it. So when you read your drugs, especially your antibiotics, always think, is my patient allergic to this antibiotic? Because that's the most common allergy we see in exams. So always look at it and think, okay, I'm antimicrobial section. Let me just think I don't end up giving anything to the patient which they are allergic to. So go back to, if you don't remember, go back to page number 2 and double check it. I know you check the allergies in the beginning of the station, but it's really important that you connect that, okay, in your own mind, that this drug is patient allergic to. Number 3, administered a drug already given as a stat dose. So that has been quite common fail as well, that you end up giving a regular drug which was already given as once only. So that stat dose means once only dose. So you make sure, like in this example here, I put it on your screen, paracetamol is due as regular drug at 6 o'clock, and that is your due time to give drugs. And then paracetamols were only already given at 4 o'clock this morning. So patient already had that as a pain relief 4 o'clock, but now is come as regular and is due at 6 o'clock. So obviously it's not safe to give paracetamol unless the 4 hours have passed. So obviously you're going to omit that drug, okay, using code 5, which is the stat dose given. So it's really important that when you come to your regular drugs, that you make sure that drug was not already given as a once only dose. So you do need to go back to that page and check, especially your pain relief things. Can be patient may have had already had a pain relief earlier on. Okay, so that's really important that check the stat doses. Right. Number 4, failure to check and verbalize your drug checks. So when you're dispensing drugs, after you did your drug chart and you have decided which drugs to give, then you need to make sure that you are dispensing as per NMC guidance. It means you are clearly, you may be doing this now, but if you don't verbalize it, examiner doesn't think you're doing it, okay? So they need the proof. So you really need to read it and also verbalize it. Don't read it just in your head. Please read and verbalize, like drug name, what you're dispensing, the name on the box, the dose, the expiry date, and then verbalize clearly how many tablets, okay? So how many tablets of each drug you are dispensing, okay? Because examiner is quite far away from you and they can't clearly probably see how many little tablets you're dispensing, but you need to verbalize it correctly because they need to understand that you have given the correct dose. So what would be my tip for that? Tip for that will be that you obviously do check and verbalize. People are checking but they're not verbalizing, so that's where they're failing, because you might be checking in your mind but you're not verbalizing, but you need to verbalize everything. And then also for compare your stock dose to your prescribed dose on the drug chart and clearly say how many tablets you're going to give of that medication. So that's really important. Coming to number 5 now, which is failure to complete documentation accurately. Now that has been again very common fail in this station, that you have not completed your documentation, especially for your omitted drugs and your given drugs. So if you're going to omit a drug, as you're reading a drug chart, if you think this drug is not safe for patient to have, maybe because patient is allergic to it or they already had once only dose, for whatever the reason is, you need to chart that straight away. Don't leave it to end, because you will forget to do that. In the end, the time is tight, you're dispensing and giving drugs, you will forget to sign for omitted doses. So omitted doses can be signed straight away as you decide to omit a drug. Like you have seen, put your drug code on, as I'm showing you at screen number 2. on your on the screen, the number 2 of the drug chart. I'm showing you where I marked number 2, so that one. So I'm showing you that I have put the emission code, that because patient is allergic to this drug, I put my signature and date straight away. And then I go to the last page of the drug chart, and then I am signing it to say, listing it, all the drugs. All omitted drugs have to be listed at the back. So I'm listing that in the back, giving all the information and the reason for omission. Not the code this time, the reason for omission in words. Code is for inside the drug chart. And then obviously signing for your given drugs. So as soon as you given a drug at the end, so omitted drugs you sign straight away when you decide to omit, and sign the last page, add to the last page, list it to the last page of the drug chart. But for given drugs, as soon as the drugs are given, please prioritize your documentation and sign for the drug, like I'm showing you on screen number here, as I put the number 1 on this page, just on the top to show you. It's no number 1 of the drug chart, but I've just numbered a 1, 2, 3 to make you understand. So the first one is for given drugs. As I've signed a for this drug, I put the signature and the date, because the time is already there. So time slot is already there. So under today, I put the signature and date. So that's how you sign for given drugs, and that's how you sign for omitted drugs. And they both need to be complete. Obviously, omitted only if you're going to omit a drug. Otherwise, it's the given drugs. Okay, and that's also really, really, really important. And that has been the common fail in this station. So I hope you understand these 5 most common fails in your implementation station, and hopefully these little points and tips will keep you safe, and hopefully you will not fall into those traps and make those mistakes. And just so just practice it that way, build in your practice all these tips, and you will be fine. Okay, so I hope you like the video and have better understanding now of the common fails. And if you like the video, please press the like button now and subscribe to my channel. And also you can visit us on OSCEnurstraining.com. Email us for more information on OSCEnurstraining@outlook.com, and I will soon be back with another video for you. So bye for now.